And just to move into healthcare, you already touched it so many times, and I know it's another passion area of yours, and you're working a lot with it right now. And I know my mom, for example, she works as a nurse as well, and when she was forced into the digitalization era and she had to write journal text, in a computer, that was such a horrible moment for her. Yeah. And I think it still is for many people, and how digitalization in that way actually made things worse in many ways. And even though it has a lot of positive sides, of course, but still from, just thinking about the worker itself, it can also have a lot of problems that at least the digitalization, transformation caused. And I guess every transformation is painful in some way. But okay, so what is your thinking about, healthcare? How can AI be of help for healthcare?
I mean, currently our healthcare system, which is called sick care, if you translate it straight from Swedish, is built around treating symptoms. So you have to wait until an infection occurs in your body, and then you have to go into a physical location and say, I want to help with this. With AI, one thing I want is for that to use my data from my Pulse Watch or my Apple Watch at all times. And I want to be able to share that so my healthcare provider can contact me when they see deviations and help me stay healthy. Or if I want to be able to share that with ICA, so they can provide me with the right healthy food so I can stay healthier.
So it's a shift in focus from sick prevention instead of rehabilitation, or whatever we should call it.
Which is natural in industry. You do preventive healthcare, or even if you with your car, you go to you go to the standard service.
And we had the same conversation has been in the car industry. Yeah. We are the safest car to crash with. Yeah, that was in the 70s and 80s, and wear a seatbelt, right? And now it's the car that doesn't crash.
Yeah, exactly.
I mean, isn't that kind of sad? It seems almost that we have more proactive care for cars than we have proactive cars for humans.
Exactly.
Right? We're more reactive in that sense for humans, that we wait until something happens and then seek help for it.
Yeah, we also exercise our dogs more than we exercise our children.
But when in automotive did the real shift happen to do prevention, crash prevention? I think that is not so long ago, if you think about it, because even the airbag. That is not preventing crashes. It's actually the latest 10 years with all the sensors. So it's quite tech related even. Or am I wrong?
No, but that was also probably regulations and policies coming in and demanding certain safety standards.
Yes.
But probably, and now I'm guessing, probably combined with decreasing profits from sales of cars. And the car companies saw that they could make more money from servicing. And again, back to the incentives of the healthcare system.
So that this was the analogy, simply to find another angle into what could AI do, or how can we be more proactive or preventive.
And that side of it requires system shifts, but one side that doesn't is just all the administration. Yeah. I think nurses spend 50% on their time, doctors about 60% of their time on administration. Everyone hates it.
It's that much, right?
Yeah. And just imagine once we reach that point where a patient-doctor or patient-nurse conversation can be real-time transcribed, we can do a recommended diagnose and a real-time literature study of the latest research that pop up to the doctor, and they say, oh, this is the latest research on this topic.
And how far away is rocket science? If I look at all the ingredients, this can be done, right? What's the problem?
Where are bottlenecks here?
What are the real bottlenecks?
Because for one, of course, if you go research, of course, it's been a lot of progress, but it's just the last 2-3 years that we've really seen the progress that we need to be able to do something like this. But then to move that into healthcare.
Into production,
Into production, and in healthcare especially, given the regulation. And I've been actually working with a number of hospitals and regions in Sweden, and they have a kind of strange. but different perhaps hierarchy. And if you have parents that are medical doctors,
Yes.
so you probably know this better than me, but if you can't come to a medical doctor that's really high up and say, no, you should do it this way. Oh. They will simply say, what are you?
Who are you?
Yeah,
I'm a surgeon.
Exactly.
we knew that.
Yeah. So it's really hard to make a change happen, right?
Yeah.
And that I think it's probably more of a challenge in terms of infrastructure and system than the actual modeling, even though that's a shift as well.
Because we had Stefan Vlachos here last time. So and
from
Karolinska University Hospital. And I'm politically incorrect, whatever. I think there is this completely wrong focus in the conversation. I'm like they're talking about how should we build the infrastructure or the perfect journal system instead of starting to break down the use cases and start doing it operational and putting things in production. So it's a little bit like when I was in Vattenfall, and we started to going on the big data journey, and we had some very clear examples. I have anecdotes for what Telia was doing versus what Telenor was doing. And I'm not naming names, but one company spent 1 billion to build a big data platform, with no value, with no use cases, but we have the infrastructure. Yeah. And someone else did the evolution approach on this. So for me, when I hear people talking in this space, it's like, I don't know, you are going at this in the wrong way. I mean, like we tried that in the enterprise world in the 90s, in the 2000s, it clearly doesn't work.
No.
So you see what I'm saying? So it's something, like to operationalize AI, you can't do everything at once. You need to drip feed it. We all know it.
Yeah, and I think you're completely right. You need to start with the user problem.
Yes.
In this instance, our citizen.
Yes.
What is it we're trying to help them with? And what's the economic structure around that? If you look a little bit further, currently the healthcare system is seen as a cost.
Yeah.
But what is the economic impact of healthy versus sick citizens over 10 years of time? Then you're seeing, okay, what could we do as a difference?
So an investment that pays back multifold, right?
Yeah.
But I think there is a fundamental shift how things are done now and how you drive transformation. Yeah. And I work at Scania right now, and this is one of my true passions, and why I ended up in Scania is because I'm with a boss that we said we need to build an innovation muscle. So digital transformation today with data and AI is not like an assist analysis, to be analysis, gap analysis. We do a project and it's fixed. It's not static, my friends. It's all moving. Yeah. So you need to have a machine and innovation. Process becomes product, we say. Innovation life cycle, use case by use cases, and just having a muscle that grows and expand. The data DNA, so you're growing your platform as you build it. And here we come into the healthcare discussion. It's like, we can talk for 10 years about getting the perfect journal systems for all Sweden. Forget it.
Yeah.
You're not going to, that way is never going to fly. And it should be enough people, even from industry, who is sort of now understanding DevOps, all this kind of stuff, that can sort of say, it doesn't really fit with software development, what you're trying to do right now.
No.
Am I speaking? I don't know.
No,
I think
I
it's
completely agree. You have to focus on the why, not
the why, what, and then the use cases, and then building machinery. How you can just do how fast can you do each use case? How fast can you put things in production?
You see his strength here in being able to concise what you just said in one word.
Yeah,
you need to focus on why.
I need to focus on why.
That's one of the excellent skills that Kye has at some points.
I think there's two organizations that I think could make a change here and probably have the responsibility to do that, and those are the unions for the nurses and doctors, because their members currently spend millions of hours on administration. They should demand from Stefan Löfven and ask for at what date will our members spend 100% of their time what they're actually paid for.
That's a good one.
Okay, so we can use AI to help employees in healthcare in different way. Of course, minimizing administration is a big and important area as well. I guess we can also potentially help nurses and other people do more advanced things if we can combine humans with AI, right? Or would you say that's also an important part?
Yes, definitely. And I would say probably, I mean, even now, even though nurses are educated to nurse people, they're doing a lot of the clinical and medical stuff.
Right.
Every doctor will attest to that. Yeah. They can do even more.
Yeah, I think so too. And then we also have the patients potentially.
Yeah.
And there are these things like precision medicine and being proactive instead of reactive, in treating injuries, and hopefully we can prevent, instead of curating symptoms that you otherwise see. What do you think about that? What if you were to compare, what can AI do for people or patients versus for employees? Where do you see the biggest impact potentially?
I think the biggest impact is the ability to give a more holistic analysis of the patient's health status beyond that individual doctor or nurse that's assessing
but isn't
them.
it exactly the same as education and even music and Spotify? You need to personalize the healthcare. Isn't that?
And the same thing with medicine as well. Currently, we're developing medicine based on a cohort of people, based on that data that we, with our cognitive limitations, are able to analyze.
I remember my mother always saying, especially she was working in more palliative kind of, in the end of the life kind of treatment. And it's so easy for doctors to just overprescribe medication. And they have this huge bucket of medicine, and the, interaction effects that they have is severe often. And people can, by simply removing medicine, make them feel better. And this is obviously a problem of, understanding data in some way.
The holistic view.
Yeah, the holistic view. For me, it sounds like...
I remember a conversation I had I was in an Indian conference, and obviously they use much more holistic medicine and also holistic healership, where they put their fingers on the pulse and they tell you what's wrong in your body, which is kind of hocus pocus to us here in Sweden. But then over just the last few years, we've seen AI and deep learning do fantastic things with heart rate variability. Being able to tell the difference in frequency in the heartbeats, and to be able to assess what's wrong with your body.
I had a friend of mine who did kinesiology. I don't know. It's something about you just put your hand 5 centimeters over your body and then you do some kind of thing. For me, that sounded really humbug kind of thing. But what you said, you actually feel the pulse and try to understand what's happening with the heart. I think that makes more sense. And all the sensors we're starting to use, they potentially can detect things that the human never could even. So perhaps they can actually improve on that quite a lot.
Yeah, it's interesting times now when you, as a consumer, you can order a blood glucose meter and wear it for 14 days and see what you eat, how that affects you, and adjust your diet based on it.
Yeah. But okay, so there's obviously so much that can be done with data and AI in healthcare. But if we sort of start maybe closing it down a little bit, what is the number one thing we should focus on, or which one is is it admin we should just tackle admin, or what is it that we get most bang for our buck? Or
the lowest hanging fruit, I would say the administration and resource planning.
Yeah,
because that doesn't require huge system shifts.